Thanks for joining us today for the AARC Perspectives podcast. I'm AARC Director of Engagement and Media, Lisa Weisenberger, and I'm here today with AARC member Angela King, who's going to discuss her RT journey and how she's making a difference in her community. Thanks, Angela, for joining me today. Can you tell me a little bit about why you became an RT and how your career has evolved over the course of time?
Whoa. Well, we're going to have to go way back in time. I've been an RT now for 40 years. I originally thought I wanted to be a teacher. So I got my bachelor's degree in education and I started teaching high school physical education in English. And I hated it, just hated it. Providentially, I was visiting a friend in Ann Arbor and she just had a baby, and the baby was in the NICU at Mott Children's Hospital. So I happened to be there visiting when an RT came in and gave the baby a breathing treatment and assessed the baby. And I was just fascinated by that. I had never heard of a respiratory therapist back then. I'd never heard the term. But when I saw the therapist working with that baby and the mother, that was it. I absolutely knew I did not want to be a teacher. I wanted to be a respiratory therapist. And I have to say, at the time, my parents were a little bit upset. Here I had this teaching degree that they helped pay for that they thought I wasn't going to use. But since then, I realized being a respiratory therapist usually requires teaching skills. I mean, we work with patients and families. We're often educating them about their disease or medications, their therapy. But instead of teaching 30 kids at a time, I'm teaching one patient and perhaps a couple of family members at a time. So there's definitely a teaching component. That education wasn't wasted, but I really enjoyed being a therapist.
What a great story. I never, I guess, would have thought it totally makes sense about the education, like getting that education degree and being a teacher and how that all works together. That's a really great connection. Can you tell me about the work you do helping the patients in rural Indiana who need respiratory care and how you got involved in that work?
Well, you'd be surprised by the wide skills or variety of tasks, I guess we could say that a home care therapist is responsible for. We set up lots of different equipment, home oxygen concentrators, portable tanks, portable oxygen concentrators, oximeters, recording oximeters, cough machines, peak flow meters, nebulizers, percussion therapy vests, CPAP, BiPAP, ASV, uh, invasive and non-invasive vents. We do a lot of different equipment. And we also test maximum inspiratory and expiratory pressure, vital capacity, maximum insufflation capacity, CO2s, all of that. We're doing a lot of different things in home care and a lot of different patient types. Sometimes we're asked to do a respiratory assessment on a patient with COPD, or maybe we're teaching breath stacking for a young man with Duchenne muscular dystrophy. Maybe we're working with a baby that was born prematurely and now is home on a ventilator. It's kind of funny, but when I was in respiratory school, I would have never in a million years have guessed that I would start a home medical equipment company someday. It just seemed overwhelming. It never occurred to me that I could do that. There are so many licenses required and insurance coverage and different accreditations you have to get. And it just seemed to me like something that only big companies with, investors and lawyers and accountants and all that kind of stuff could do. But thankfully, my husband is a good business guy, so he figured out all that legal and financial requirements. And he's a biomed technician, so he can fix all the equipment. So that freed me up that I could do the part I like, which is actually going into the patients' homes and working with the patients and the family. I just love that. We specialize in home ventilation. We do invasive and non invasive. Everybody's always wanting to know what percentage of each. And I'd say it's roughly 50 now, invasive and non-invasive. That non-invasive component it just keeps getting bigger and bigger. But it's such a privilege to help patients come home from the hospital. It's just an amazing feeling. And we try to follow Dr. John Bach. I saw him give a speech when I was a young therapist. I think it was 1988. And that was the first I had really ever heard about non invasive ventilation. And that just, it really changed my life. I thought, oh, I want to be a part of that. And I want to help people at home with that non invasive ventilation. And I remember Dr. Bach said that patients with neuromuscular disease, if they can talk, they don't need a tracheostomy. And that was just amazing to me. That was such an easy thing to remember. But that little phrase has really stuck in my mind, and it's been something that we've used a lot, been able to help people with. So we do non-invasive mask ventilation and mouthpiece ventilation, aggressive assisted cough techniques at home. But we also just started using something new for us, but apparently it's been around since the polio days, intra-abdominal pressure ventilation, also known as IAPV. And it's a part of our non-invasive program now. It uses the patient's own ventilator with an exhalation belt. And the patient wears that belt around their waist and fills with air, pushes the patient's diaphragm up, and that helps them to exhale. And then when the belt deflates, that allows the patient's diaphragm to drop, and that causes the patient to inhale. So it's kind of doing the opposite thing. When the ventilator is sending inspiration, it's helping the patient exhale and vice versa. But between mask ventilation and mouthpiece ventilation and IAPV and cough therapy, we've really been able to make a big difference, especially for the neuromuscular patients, and help them avoid the tracheostomy, or at least avoid it for as long as possible. So we really are grateful for that opportunity.
That's a lot of different pieces that I don't think a lot of people realize you could do, or maybe it's just me, but that you can do all of that in a home environment. How did you and your husband decide that you wanted to do the home medical equipment program? Like, what were you working in the hospital and then you're like, "Oh, I can be of better service, in a home environment," or how did that kind of come about?
Well, yes, I had started working in the hospital, and it wasn't very long until that hospital started a home medical equipment company. And that was very common back then, that the hospital would have a department for home care. And I think some hospitals still do, but for the most part, I don't think that model is still in play much. But I just was so fascinated by it. It just really fit my personality, getting to go into patients' homes, and you meet their family and their pets, and you see their hobbies. Maybe the lady's a quilter and you see these beautiful quilts she's working on in the living room, or the guy shoots bows and arrows in the backyard. I mean, you name it, we've seen it, and we get to know our patients. I mean, I've had some patients for over 15 years, and you really develop a long-term relationship. And that was just really appealing to me.
How do you think other RTs could get involved in doing similar work like this or other work like you do in rural areas?
Absolutely. And for us being in Indiana and this a lot of cornfields around here, a lot of soybean fields, you do have to like to drive. And I do, or my husband drives me a lot. And there's just nothing like it. You're going to go for a drive out in the country. And when you get there, you're going to meet some nice people. And most of the time, they like us because we're helping them or helping their family. So it's just such a positive experience. But I know a lot of home care companies offer part time work or full time work or contract work. I think for the most part, RTs that have an interest in home care could keep their hospital job and maybe work part time or on the weekends or maybe do some contract work. For us, when I say contract, I mean the therapist is typically paid maybe per home visit plus a mileage allowance. But I think more and more RT education programs are including a rotation in home care now for their students as well. But it's a wonderful career. Think it's a bit more family friendly than hospital work because for the most part, we're working 9 to 5, Monday through Friday. And we get that long-term relationship and it's very rewarding. It's not glamorous like the ICU or, super exciting like an emergency transport. It's not like you see it on TV, but it is a wonderful career path.
Yeah, it sounds like it.
If you choose a career in home care, you have to be very self motivated and comfortable working independently. When I go into a home, there's nobody else there to confirm my assessment of the patient. There's nobody there to troubleshoot a problem with events. So that can be a little bit daunting, I think is the word I'm looking for because you're out there by yourself and you also have to be super organized. And that took me a number of years to get better at. But you do not want to drive 90 minutes, maybe in bad weather. You get to the patient's house and you realize, oops, I forgot the AV filter or something. It's really, really important that you have good organizational skills.
Yeah, I would imagine you have to be very organized with your time.
Yes.
Um, I guess you've done all this amazing work in all these different areas, and what do you think has been your biggest career accomplishment?
That's a hard question. Along the way, I have worked for large hospital system, a couple of big national home care companies. I worked for a while as a surveyor for the Joint Commission and several ventilator manufacturers. And then, of course, my favorite, our own little home care company. But I guess out of all that, I think I have two accomplishments that meant the most to me. First, I had this amazing opportunity to have input on the design for several home ventilators. And starting back in, I think it was 1998 or so, I was so proud to be part of the team for the LTV, the laptop ventilator. And I think the timing was right that the LTV really revolutionized home ventilation because it was the first small turbine driven, easily portable home ventilator. Mm, Prior to that, the vents were, I don't know, 35, 40 plus pounds. So I think the LTV coming out being so small and portable, it helped normalize patients on vents in the community. they're going to public school. Maybe they went to the movies. They go on planes. I would see even patients on airplanes traveling, just getting out and about, out in the world. And when I was a brand new therapist, you just did not see that. So I think the ventilator technology evolved and that enabled patients to achieve their full potential at home. So that was really something to me. Just the timing was right, the technology was right, and I got to be a part of that. And I
Wow, that's
think the second accomplishment that was, frankly, it felt a whole lot more like work, but I got to work with Dr. Dean Hess to write the chapter on home care in his textbook, Respiratory Care Principles and Practice. And writing a book chapter to me was incredibly hard and time consuming and hard. Did I mention that? It was really hard, but I was so proud that home care was included. It felt like an acknowledgement of the home care therapist's importance. We were seen, we're valued, and we're part of the team. So that felt like a really big accomplishment.
yeah, wow, that's amazing. All of both of those are amazing accomplishments. I guess on another accomplishment, you recently won an award at the CHEST meeting this past fall. What did that mean to you?
Well, I was super excited because I was the first respiratory therapist recognized as the Margaret Fromer Award recipient. And that award was created in 1999 by Dr. Eveline Fauer and Dr. Alan Goldberg. And they created and endowed that award to honor their lifelong colleague and friend, Margaret Fromer. And Margaret was a polio survivor and a famous patient advocate. So the American College of Chest Physicians present that award annually to a clinician or ventilator dependent professional, patient advocate, someone who has advanced mechanical ventilation and fostered partnerships between physicians and patients. So I was excited, but I was super nervous too, because the award recipients have to give a lecture at the CHEST meeting. So again, it felt really good that the home care respiratory therapist was noticed by the CHEST physicians and valued.
Wow, what a great another great accomplishment for you and to be able to have the profession recognized in that manner and especially for home care to be recognized. That's really outstanding. With all of your background and your knowledge, what would you tell newer RTs about the challenges that they might face in respiratory care today? And maybe especially with in the home care field if they're interested.
Well, I know a lot of people who've gone to college and received their degree, but then couldn't find a job. Really, I've known people. I even know one young man that went to Stanford and had a really hard time finding a job. And I have been so fortunate. I've always been able to find a job that I really enjoyed and easily as a respiratory therapist. So thankfully, finding a job in respiratory care has never been, in my 40 years, has never been difficult whatsoever. So that's fabulous. But I think the biggest challenge I have faced while working in home care has been gradually learning how important reimbursement issues are to patient care. When I was a young therapist, the doctor ordered something and the insurance company paid for it. I mean, without question. We just didn't even think about that. We didn't think about the bill or the reimbursement. We didn't worry about it. It was just whatever the doctor ordered, we could do. I guess I came on at the right time because the Katie Beckett waiver had just been passed before I got started in home care. The Beckett waiver was passed in 1982 by the Reagan administration, and it opened the door for Medicaid to pay for patients to receive home ventilation. Of course, back then it was almost all trach, but to receive home mechanical ventilation instead of having to live in the hospital. And at that time, the insurance company seemed only too happy to move patients from the expensive hospital care environment to the less expensive home care environment. I mean, they just didn't quibble if you wanted two ventilators, two suction machines, or whatever the patient needed, they were happy to provide. And there was just no such thing then as having to get a prior authorization or having to fight an insurance denial. I guess over the years, sadly, navigating health insurance rules has become such a big part of patient care. And I don't think it matters anymore, the care environment. I think all of us as respiratory therapists have to be aware of that cost element, that reimbursement element. And I spend a lot of time now writing letters to insurance case managers to advocate for my patients so they can get the equipment and the services they need. And I don't think that's going to change going forward, regardless of the environment of care you work in. So I think all of us have to be continually cognizant that healthcare costs money. And we all have to do our best to make sure the patient can get the care they need as economically as possible.
Yeah, those are all. I have a bonus question for you that I was just actually thinking about. How has AARC helped you during your whole RT career journey, and how have you been involved with AARC?
Well, again, I've been fortunate. I've been able to attend many, many of the congresses. So of course that's a no-brainer because I can get a lot of my CEUs all in one fell swoop. So of course I've always enjoyed that. But they've also helped with reimbursement issues. At one point we took a busload of our patients to Capitol Hill. This was something AARC had organized, and we were able to the patients to speak with several senators. Those appointments had been made for us. So we were able to kind of have a rally on the Hill, and that was really exciting. And we learned. But over the years, definitely. Oh, and of course, the resources on the website are helpful. But the reimbursement, them fighting for reimbursement, not just for hospital care, but also to help us with home care issues, has been invaluable.
That's great. Yeah, we definitely have done a lot of work with the SOAR Act and continue to fight those battles there. And hopefully in the upcoming year, we can get some additional progress on that. So I
Yeah.
appreciate that. Any other thoughts you'd like to share about your career and all of your work in the RT field?
Well, I do have a couple. I couple of thoughts. I think being a respiratory therapist is something to be proud of. We help so many people. And in a weird way, as awful, horrible, horrible as COVID was, it did help people recognize our profession. And I do feel like now most people know what a respiratory therapist is, and they have some idea of what we do. And so that's been just a huge change in my lifetime, a very positive change. And then the other thing I want to talk about, you might think it's a little bit silly. I'm a little bit philosophical here, but for all my life, I worked hard. I know most of us do. We work hard. And I always look forward to retiring. Someday I'm going to retire. I think most of us are like that, right? I mean, sometimes we just don't want to get up and go to work. And we dream about this time when we won't have to. But it's funny, I had some very serious health challenges to battle through the last few years. And I was working the whole time right through it. And I finally get to age 65 and I finally retired and I couldn't stand it. I missed being a respiratory therapist so much. You can't believe it, but I did. I missed the patients. I missed my colleagues. I missed driving house to house. I miss the pride and that self identity, that comes from doing a good job and helping people. I missed it so much, I started another home care company so I could keep working at least part time. So, I have to laugh. My dad was right all my life. He said, be careful what you wish for. Be careful what you wish for. And I have to say, he was so true. But I think that's one of the great things, too, about respiratory care. There are options where maybe you don't want to work 40 hours a week, or maybe you want to work these certain days or these certain shifts. And I think our profession gives us that flexibility. So now we opened a new little home care company and we're doing 4 days a week. So that's my new job. And I love it.
Well, still, that's quite a bit, 4 days a week. So, and I think what you've talked about too kind of goes with when you love what you're doing, it never feels like work. And so I think maybe that's a good thought to end on with the passion that you have for respiratory care and helping your patients. So I really appreciate you joining me today. This has been such a great conversation.
Well, thank you for having me. I enjoyed it as well.
And this wraps up today's episode of the AARC Perspectives podcast. A huge thank you to Angela King for joining me today and sharing her stories about her RT journey and impact. Be sure to subscribe to AARC Perspectives wherever you download or listen to your podcasts.